Okay, there's some injection therapies. Most of us have probably heard about steroid injections, I would assume, steroid injections for the knee. Okay, so a corticosteroid is a anti-inflammatory, very strong anti-inflammatory, but there are some problems with those as well. First of all, the natural repair cells within the joint already are completely wiped out. Steroids just destroy them, which means if there's any repair or regenerative process going on, it is absolutely halted by a steroid. After that, cartilage cells are actually injured, which will result in more cartilage loss. So a cortisone injection for knee pain, especially arthritic knee pain, it might feel good for a while, but it's actually going to make the problem worse. There is a risk of infection, and there's information that says that you're going to be more prone to fractures following cortisone injections as well. Yes, sir?
When I first started having a problem with my knee, the orthopedic said that one of the first things that the insurance company wants to do is to make sure that you get the injection before they go any further.
Yes.
So, I mean, if it's going to wipe out all of the cartilage that I have in there and further damage, why would they do that?
There's two reasons. What's that? It's cheaper. It's so cheap. The cortisone that they inject in the knee probably costs about $10. It's very, very cheap. It doesn't cost your insurance a lot, and they're gambling that you're going to die before they have to do anything else with it.
They lost.
They lost. And they do lose quite a bit, but it doesn't cost them very much, and it puts you on the first step towards joint replacement. Now, you might think, well, that's expensive. The insurance wouldn't want to pay for that, right? Well, this is really interesting. You can call me a conspiracy theorist after I tell you this if you want to, but when Obamacare was introduced, insurance profits were capped at a certain percentage of the premiums. Anybody notice their premiums going up? Mm-hmm.
It's good for 1 year.
Mm-hmm. It's good for 1 year.
Yeah, and it's good for 1 year for us anyway.
Yep. I was same situation. I was like, I'm in good. And skyrocketed after that, didn't it? Because the insurance decided we can only profit more if we raise premiums. How do we raise premiums? We pay more for care, for certain types of care. So now, if they can get you down the road to joint replacement sooner, that's the more they can have paying on premiums, which means they can then profit more. Remember, your insurance is not there for your health, they're there to profit. Even Medicare, which is publicly funded, they're not there to profit, they're there to spend as little as possible, which essentially is the same ball game. Okay, so we know this is, I've got sources for all this. If you guys want these sources, I'll be happy to send you everything. You can just make a little note on your little survey card, and we can send you an email with all the sources if you want to look this stuff up. But this is very well established. We know this happens. We've known this for years. This study, this first study and the second study are from like 2015, 2013. We've known it for a long time, and we just keep doing the same thing. There is brighter light here, though. Oh, there we go. We're opening it up. Sorry. Okay. There is a light here with injections. Who's heard of hyaluronic acid injections? Good. Okay. So these are really interesting. It sounds kind of toxic, hyaluronic acid, but it is actually a part of synovial fluid, which helps keep your joints moving freely, and it actually protects the cartilage. They've been able to isolate that to where they can put that into the knee in an injection form, which helps to open up that joint space, make everything move smoother, and protect the cartilage you do have. It does not have the destructive capacities that steroids do. It's not an anti-inflammatory though either. So some people really like that steroid because it makes them feel good right away. This sometimes does, sometimes it's more of a delayed effect, and sometimes people don't really notice much of a difference at all. It depends on the kind of the progression in the knee itself. But it's very, very safe, and it's a good option if you need to slow down damage, slow down that degenerative arthritic process, and try and save what you do have. One of the problems we have with it, though, is like he said, the insurance wants a steroid. They want to see that you've tried that before they even get to this. So rather than trying this first even to try and save the knee, we're going to start the destructive process. We might throw some of this in there, and then we'll get you over and get your knee replaced.